there have been no additional COVID-19 deaths, and 63 people have recovered from COVID-19. So, in summary, the combined total of confirmed and probable cases in New Zealand today is 589, 75 more than yesterday. Today, we have 12 people in hospital with COVID-19 infection, and it is good news that 3 of these people are expected to be discharged soon. There are people currently in Gisborne Hospital, Waikato Hospital, Whangarei Hospital, Dunedin Hospital, Auckland Hospital, Nelson Hospital, Wairau Hospital in Blenheim, Taranaki Base Hospital. Each of those hospitals has 1 person, and Wellington Hospital, which has 4. 2 of the current inpatients are in intensive care, and for privacy reasons, we won't be providing other details on these patients. Our laboratories around the country continue to process and report test results quickly, and over the last 7 days, the average daily test number is 1,728. And just a reminder, anyone who has been tested is expected to be in strict self-isolation until they have that test result back. We are still seeing a strong link to overseas travel, as well as links to confirmed cases. And I just have some information that I've just received. On the 455 cases where we have sufficient information presently, 57% of those have a direct link to overseas travel. 26% are close contacts of existing cases. 15% have both overseas travel and or close contacts. And just 2% are currently community transmission. That's around 10 cases that we know are definitely community transmission. I'd like to shift to talk a little bit about flu vaccination. Flu vaccination is going to be a very important part of our overall approach to COVID-19, because if we vaccinate people, then we can reduce pressure on our hospital system, particularly through winter. It's very important that the people who are eligible for free flu vaccination are prioritised for vaccination. So that is people over 65, people with pre-existing medical conditions, pregnant women and children with a history of a respiratory illness, as well as our frontline health and other frontline workers. For people who are not in those groups, who might usually get a flu vaccination each year, please wait. We are prioritising our resources to vaccinate those high priority groups. We want to keep our frontline workers well so that they can support our COVID-19 response. We want our people who are most likely to get complications from influenza if they get it, and therefore end up in hospital, to be vaccinated first. We will not be, or you should not be seeking a vaccination or expect to be called for a vaccination if you're not in one of those groups until at least mid-April. This is an important part of our overall response. There is plenty of vaccine. We have 400,000 more vaccines this year than we had last year. That's a 30% increase, and already 800,000 have been distributed. There are stories of some practices who have run short, and so we are working right across the country to redistribute the existing vaccine that is already in the system so that all practices who need it are able to vaccinate those high priority groups. And a final word on our surveillance for COVID-19. There is an existing online, in fact, it's an email that you get each week called Flu Tracker. It asks about whether you've had symptoms of a fever or cough in the last week. We have now extended the questions on that Flu Tracker to include whether or not you've had a swab or a test for COVID-19. And I would encourage everybody to help contribute to our tracking of COVID-19 by registering online on the Flu Tracker survey. The website will be in our media release, but just quickly, www.info.flutracking.net. This is a practical way that we can all contribute to the monitoring of influenza-like symptoms and specifically to COVID-19 across New Zealand.
First off, in terms of how New Zealanders are complying with us, the vast majority of Kiwis, of people inside New Zealand, are complying brilliantly. and I want to acknowledge and thank them for doing that. They know that to stay home saves lives. At the same time, those people who are complying are very passionate to ensure that others comply. To that end, as you know, we stood up a online facility 10.5 at police.govt.nz at 1 o'clock yesterday. Since that was stood up, we've had 4,200 reports of people believing others weren't complying. Again, it shows how determined Kiwis are to ensure that everyone complies with us. We crashed that system. We've put it back up again. It's working. But again, I just want to say that everyone needs to comply in this realm. We have, for example, tourists who think it's okay to drive around the country in their camper vans. It's not okay. Stay absolutely put. Stay in place. We have, over the last few days, had cause to arrest 3 people for persistent breaches. Now, 2 of those people were taken into police custody, but later released without charge. 1 person remains in police custody, mainly because they had other outstanding matters in front of them. But again, we will be out there ensuring people do comply, because we can't say it enough, stay home saves lives. I also want to talk about how things are impacting on policing in general. A few days ago we talked about the anticipated rise in family violence, family harm offences. Initially we did see a small rise, but it's pleasing to see that in the last few days that's been reversed, and we've had a very slight reduction in family violence, family harm reports. I think that goes to the fact that people really do want to respect each other inside the home and know how challenging this will be for everyone. But of course we've got to stay the course on that. We've seen a massive decline in public place violence, as you would expect. We've seen a significant decline in the number of people being arrested and placed into police custody generally. All positive things which enable us to redeploy into those other priority areas, which include ensuring that people comply with the COVID-19 restrictions. I can report that we have 2 of our own staff that have tested positive for COVID-19. They are at home, taking every precaution, obviously. They're not hospitalised, and we're putting every piece of support we can around them. I'd also like to report, Ashley, you'll be interested in this. You may know that last week we graduated the Ashley Bloomfield Recruit Wing, 59 staff. Today, all 59 of them have deployed and are out there on the streets of New Zealand doing everything they can to keep New Zealand safe. Well done on that, Ash.
Thanks, Mike.
Finally, I'd like to talk about the number of returning New Zealanders. Since over the last 3 days, we've had 4,547 Kiwis return. As you know, we have a process in place, an end-to-end process to assess them and then ensure that they are compliant. 94 of those people were symptomatic and are in quarantine. 1,200 of those persons did not have a satisfactory self-isolation plan, so they are in managed self-isolation. About 3,200 did have a plan and they are self-isolating, but we are sure complying with that, although we will ensure that we have a process to visit those people or to ensure that they are complying with those restrictions. So that's all I have to update at the moment, other than to say and acknowledge those essential workers that they're out there keeping the country going, keeping the country safe. They're doing a wonderful job and they should be acknowledged for that. Kia ora.